Hello, everyone. My name is Erin, and I want to welcome you here this afternoon. On behalf of the Pennsylvania, Virginia, and West Virginia MGMAs, I'm pleased to welcome you to our collaborative webinar series. I am also pleased to welcome Matt Seefeld from MedEvolve. Matt is coming to us from the West Coast, so we really appreciate him joining us. It is very early, well, not very early, but it's a little early for him. So I really want to welcome him and thank him for joining us. Matt is the Executive Vice President and Head of Effective Intelligence for MedEvolve. He has over 20 years of experience in assessment, design, and implementation. I'm reading this for him, of process improvement and technology development across the revenue cycle. I am really thankful for Matt and Ashley who helped from MedEvolve who helped to schedule us today. And I am going to turn everything over to Matt.
Cool. Thanks, Erin. And you know, with so much business in the Central Time Zone and East Coast, I do tend to get up pretty early. So I won't call this midday for me, but it's, you know, late, early afternoon. So I appreciate the time. I enjoy this topic. I spoke about it last week at a conference. I'll speak in Boston. Maybe some of you will be in Boston in a few weeks at MGMA, and I'll be talking about these themes as well. My whole career has been in healthcare revenue cycle. Started out as a consultant, which kind of gave me the building blocks to look at the inadequacies in the practice management systems that we are using to basically get claims paid. And really the inadequacies around how do you measure in an objective, non-emotional way, employee effectiveness. And it goes far beyond just an AR situation. So it's kind of my start. And then I built 3 workflow automation softwares over the last 20 years to bolt on to inadequate PMs. In my free time, I do sit on some boards. I also started, if anyone out there is suffering or knows folks suffering from emotional, physical, or behavioral addiction, check out my LifeLink. It's a free app. It's a virtual community that users are using around the world to get healthy and rebuild lives. And I'm also a track and field enthusiast and coach Little League. So let's talk a little bit about, and just frame it up. If there are questions, I'll do my best to kind of keep an eye on the Q&A chat. I'll probably end up answering a lot of them towards the end. So, but please write your questions down as we go through this. So we'll talk a bit about the current state of RCM employment. I don't think there's really anything I'm going to tell you that you're not all experiencing today. We're going to start introducing what the concept of incentive-based revenue cycle means, right? How do you actually create a gamified experience that rewards outcomes for a generation of workforce now that wants to be paid more, doesn't want to work as hard, but expects to be recognized. So things are changing. We're going to introduce the concept of effective intelligence, and really that is more down the pathway of who's effective and who's not, and where are there areas in my revenue cycle, and to what magnitude can I improve process, basically, and people and technology alignment to get better net collection rate. A little bit about results, and then we'll summarize it. Just got some polls just by way of hands. How many folks here represent hospital, health system, medical group, RCM company, emergency medical services, consultant, other? Any stat? Oh, there we go. All right. Okay, interesting. Yeah, 27% hospital and health system, 64% medical group practices, and some billing companies. So that's great. This is the ecosystem that we're talking about. Okay, so I'm not going to spend a lot of time on this. I think everyone's well aware of what's happening with really employment in general in this country, specifically the frustrations and pains of trying to hire revenue cycle individuals, right? We're talking about, and I know there's a clinical challenges too, PAs are in short supply, medical assistants, et cetera. But what we're talking about today is the perceived short supply of revenue cycle individuals. And what's interesting is most organizations are actually overstaffed today, yet they're looking for people they don't need. And we're really going to hit home on that, you know, throughout this presentation. So we know that people are more expensive, right? We know that I can go work for another place down the street and make more money. There's this new concept of quiet quitting out there, which is kind of a funny buzzword, where I'm not really engaged. I expect to be paid really, really well. And I just want to kind of stay, under the radar, right? And with practice management systems, it actually can't measure effectiveness. That's really the most risky part right now, is that you can't afford to have people on your payroll that aren't effective. And the ones that you do have effective, you need to incentivize to keep them. Half our business at MedEvolve is RCM services, so we're feeling the same pain everyone else is that runs a rev cycle, right? People are more expensive, they're hard to find, they change jobs too frequently. Our HR director made a good quote a few months ago that said people are looking for jobs, not careers anymore. So how do we relook at building a career for individuals where they're actually incentivized to do their best job possible for the organization? So Maslow's needs of hierarchy have actually changed, especially with this new generation, X and Z coming up, that's going to start to populate a lot of our revenue cycles. When you think about the physiological and the safety needs, those are just assumed by these folks, right? It's just assumed. I mean, there's 20, 25, 30-year-olds still living at home, some of you may be smiling and laughing right now. But at the end of the day, we just assume that that's being taken care of. However, with this recession looming and things like that, those might be impacted. But here's the interesting thing is it's really the love and belonging, right? And it's the esteem. And esteem is really where I want to focus on. Is it, this new world of vanity, selfies, look at the best me, likes, right? Nonsense, TikToks, right? All that stuff is people want to be recognized in their best view. And so how do we take that and apply it to work where they can be recognized, but more importantly, they can deliver for the organization, which will reduce the labor dependence and improve the net revenue, which which obviously drives margin. So the other big thing too is, and we'll do a poll here in a second, is really this new normal that's out, is that people want flexibility. When I spoke at MGMA, it was last year, and then I did a few shows this spring. It was amazing to see the hands of how many people went from nobody's working from home to hybrid to really all. In fact, at HBMA this last week, I think 95% of the room had sent everybody either home completely or a large portion of their staff based on the RCM functions. So quick poll, has your organization implemented a work from home, or what I like to call work from anywhere option? Yes, no, or hybrid? While you guys are answering, we're actually now using this as a recruiting strategy whereby I don't have to recruit in Little Rock, Arkansas, where the company is headquartered anymore. I can recruit where the labor is the best and actually the most affordable. So when you can have a virtual work environment. So let's see, 36 yes, 43 hybrid, and there's still 21% no. So kind of gives you an idea of where we're at. 2 years ago, obviously, it was pretty much no. Right. So what's the key to being able to send folks home and be able to really look at effectiveness, right? The key is you have to be able to track and monitor what people are doing, right? And you have to do that in a structured way. You're going to hear me use the term structured data a lot throughout this presentation. All I mean by that is structured data is literally a data set that I can grab and report on. Unstructured would be, I spoke with Bob at Blue Cross. He told me the denial was no authorization. I did this and this. It's unstructured. It's not reportable. So we're going to talk about some of the limitations in PM systems that are driving the need to look at upgrading that PM, not change it, but upgrade it to be able to put systems in place that captures that data, that tells that story. But you have to be able to measure effectiveness, especially if you send people home, okay? And the other thing too is that, that last bullet is that you can't afford to lose an effective employee, right? That's worst case scenario. If you're overstaffed today, and you start to get into normal staffing and you start to reduce staff, you certainly can't reduce staff person who's effective. And don't productivity and effectiveness are two different things in my world. I can be highly productive and not effective at all. I can be moderately productive and very effective, right? So I look at effectiveness really more than I look at productivity, right? But the problem is PM systems can only give you productivity, and many can't even do that. So let's talk a little bit about the service profit chain. This is actually an article I read years and years ago from I think it was the 1980s. And basically the premise is that a lot of businesses focus on external service value first, right? It's what the customer needs, right? And your customer can be different, right? It can be your patients, it could be the physicians, right? I mean, it could be each other, right? But the mistake organizations make a lot of time is they focus on that piece, right? And they think by focusing on the customer that will somehow drive satisfaction, loyalty, revenue growth, and profitability. Well, what this individual found was that's not the case, right? You have to focus on the internal service quality first, which is what your employee experience is, right? And when you think about organizations that get it right, like a Ritz-Carlton, Walt Disney, and they're focusing on what their employees are able to do. They're empowering their employees. They're measuring their employees. They're recognizing and rewarding their employees. And as a result of that, they've got retention. They've got improved productivity and outcomes, which then drives the customer experience, which then drives satisfaction, loyalty, revenue, growth, and profitability. So start thinking about your organization today and say, where are you today? Are you focused more on the employee internal service quality, or are you still focusing more on the client or the customer? So automation, it's a buzzword. You read it everywhere. Every billboard at MGMA vendor will have it on there, right? Automation makes a lot of sense, right? If we can reduce the need for specialization, if we can improve processes that used to require humans that no longer require humans, right? It's here, but here's the one thing that I want to make sure everyone understands is that humans will always have to be involved in some extent in revenue cycle, right? I don't think I'll still be gainfully employed in a time where robotics or AI or machine learning is somehow taking that claim from a visit and getting everything paid and posted and reconciled to the bank without a human getting involved. The trick is understanding where and to what extent humans are getting involved in the process. And then you start to look at where you can automate. So I start from where are you getting involved and then look at automation tactics rather than I think I can just grab this and this and this and I hope that works for me. It can be a very big distraction to your IT department and very expensive, and you may get it wrong. The other big thing that I want to address is this concept of chatter. I call it RCM chatter, right? How many back and forth does it take throughout your entire revenue cycle, which would also include clinicians at times, to get a claim paid correctly? Nobody can answer that, because if I'm working a Blue Cross claim or a claim and I need someone from coding to look at something for me, I send an email. Maybe historically I could shout over a cubicle, but nobody's in the office anymore, so we can't do that. Notes are out. Maybe phone call, maybe face-to-face. None of that's trackable. None of it's tied to the visit. So think about the back and forth in the way you communicate today. A lot of you are sending emails. A lot of you have spreadsheets, smart sheets, right? None of that's trackable. You cannot really understand how much effort is going in and how many people have to touch. If I had a study I did the other day with some of our own RCN business where I found a claim that had gone to 6 different people, had been touched 37 times. And you know what the net on that was? It was $125. That was what we got paid. So let's think about that in the context of labor costs, which now people cost more money, 22, 23 bucks an hour. They're not 15, 18 anymore, right? It's driving costs. You have to be able to monitor chatter, okay? You have to. And it's got to be integrated to a workflow automation system, and it's got to be tied to the visit, because everyone has to be on a level playing field, right? When I have conversations now within our own RCM team or within our RCM clients per se, I'm having conversations like, here are the number of open tasks there. Here's the average turnaround time. Why are so many of these unread? Why are you, look at how much money you're holding up because you're not responding to tasks, right? I mean, it's a very non-emotional, objective presentation of data. So it really does change the game. The other big thing is automating task lists, right? This is where claim profiling comes in. There's some AI, some machine learning aspects to this, but think about, an AR rep calls an insurance company, gets told something, and then they have to pass the buck. Well, why didn't it just go to that person to begin with, right? You have data, but you don't have all the structured data in the PM to be able to really profile some of these claims to get them routed to the right person the first time. Again, if you hear what I'm saying, I'm trying to reduce your labor cost by reducing the work effort to get you paid what you're supposed to be paid on time, right? And the only way you can do that is to actually have meaningful intelligence driven by meaningful structured data that just doesn't get captured in PM systems that we're all using. So let's talk a little bit about incentive-based revenue cycle. So I actually this was 2004. I was working for one of the PwC at the time. I was staffed on a big health system up in the Northeast. And I started to think to myself, why are we pushing staff so hard to improve the P&L, right? The net collection rate. I think, we were trying to get a 3% improvement in that NCR. And I started thinking to myself, if I had highly motivated people and I were to give a fraction of that improved NCR back to the staff, what would that then do to the ongoing financial performance of the organization? And the models I was developing were it was insane, the amount of money. I mean, individuals could walk home with $10,000, $15,000 each by being effective, and the organization was getting 25x that, or more. So quick question, are you currently measuring performance, offering employee incentives? And it really could be anything. Just curious on who's really looking at beyond just their compensation. All right, no, 100% no's. Okay, all right, well, let's talk about it. So what was my limiting factor back in 2004? I know you'll be surprised when I say it. I couldn't capture all the structured data I needed to look at every employee in revenue cycle. And the tools we were using at the time, I had structured data around AR teams, but when you start thinking about pre-registration, financial clearance, you start looking at charge entry coding, payment posting, et cetera, that's where it got lost. So fast forward, I guess, what is it, 2022? So fast forward 21, 22 years later, and now we're starting to be able to do these things. So if you think about the value of this approach is that you're going to reduce turnover, you're going to improve productivity and outcome, morale is going to improve, people are going to want to work here, people are going to tell their friends that they should work here. You're also going to reduce folks looking elsewhere, right? Looking to move down the street. There's going to be a lot of teamwork, collaboration, brand reputation, and healthy competition. I'll tell you right now, the healthy competition has been exciting to see. Is that you really start to see the folks that have been actually working hard and are now proud that everyone can see that. And then you see people rise up to that level, and you see people self-select out. Now, the ones that self-select out go work at Starbucks or any of these other Amazon or any of these other places where you can make more money. You don't need them in your revenue cycle. They're expensive and they're not getting the outcomes that you expect. Okay. You need the right software. You need the right structured data capture. So what are some of the things that we look at here? In order to measure effectiveness, you really need to understand every unit of work, which includes those task chatter that I was talking about. More importantly, you need to understand the result of the work, right? Because there's desired outcome and then there's outcome, two different things. I expect to collect this. What did you actually collect? And if I didn't get what I expect, why? So what's the rapid intelligence to tell you why and how I can go grab that extra penny or two or whatever that may be. So it's really important piece there. And then, of course, looking at how effectiveness allows you to retain your high performers, obviously train or move out lower performers. I will say there are a lot of folks in our organization who are starting to be more self-sufficient. They're starting to look at training opportunities. They recognize some gaps in their ability to get things done efficiently. They rise up, and then we support that. We pay for training. We want to encourage employees to educate. Sometimes we find out that the individual's in the wrong role. Somebody that was in the call center team would have been better suited in payment posting or AR management. And so you got to think about too, as you look at your staff, some of the effectiveness, it may be tied to not their willingness to be great, but their capability of being great. And the willingness and capability are two things you've got to look at side by side, because there may be folks out there that are just actually in the wrong position in your revenue cycle. The other big thing I'll just say, because it's top of my mind, is that I highly recommend specialization in revenue cycle. I've done this for too many years. You don't want a lot of distractions on people. You want to have these individuals come in, know the work they need to do. That work has to be driven to them. There's no freedom of choice. It's not, I'm going to work this claim or that, or I'm going to go verify benefits for this one and not that one. It has to be driven to them. But you need to make sure that people know this is what I do. If I'm an insurance representative, that's what I do. I call insurance, I get paid. I don't answer phone calls. I'm not overflow for call center staffing shortages. I'm not doing payment posting on the slide, on the side. I am doing what I'm supposed to be doing. Here's why that's important is when you start looking at effectiveness and you start comparing individuals, that's how you compare because they're like individuals doing like things. And now you measure the outcome. So why provide? I think we've hit on this a lot, right? Provide incentives to really drive margin for the organization. You also, it's amazing to see what just small movements of net collection rate will do for organizations. It's so much return on investment by having lean, effective labor driving the net collection rate to benchmark or close to that. Okay, giving a fraction of that NCR back to employees is going to do all the things that I just talked through. Right, it's also competitive advantage for recruiting. You think somebody's getting incentivized for the work you're doing. Are they really going to go to the clinic down the street or the hospital in the next town? Are they? You know, it's probably not likely, right? And then at the end of the day, happy clients, happy customers, happy patients, right? Happier physicians. And that goes back to the service profit chain that we were talking about. Some of the different forms of incentives, you know, a lot of organizations are limited. And when we first started this journey a few years ago, we were limited too, you know, blanket raises. Hey, you know, our cash budget was this. You guys exceeded it 105% of budget. We're going to give everyone a few $100. It's not really ideal. Rewarding the whole team, you know, is also an option, which is better than just blanket raises. I think where this market is going and needs to move fast is how we reward the individual for the individual effort, right? And that's what we're going to really spend the balance of this discussion on. Some of the incentives, there's lots of things that are out there. You can do bonuses, cash bonuses, awards, corporate gifting, platform companies, stores, branded merchandise, you know, employee choice, expense reimbursements, PTO, you know, you get half a day of PTO this, you know, next month because of how you perform, prizes, gift cards, you know, team treat outing. It's a lot of different ways in which you can incentivize folks for the work that they do. Making sure you set goals to determine incentives. And this is, again, where you have to really think about objectivity, right? When I look at an individual, what are the things that I am going to measure that individual on, right? Is it productivity? Is it resolution rate? Is it benchmark to their peers? Is it touches to get the outcome you expect? Is it the collectible, you know, did you collect what was available to collect, right? There's different measures out there that with the right system in place, you can actually tie back to the individual. And then when you look at the macro revenue cycle overall, it's things like zero touch rates, which we'll touch on here, no pun intended here shortly. It's, you know, obviously the net collection rate I'm a big fan of. It's looking at AR performance, claim resolution rates, exhaustive visits, lags, right? So there's other macro things, some of which you can measure in PMs today, some of which you just can't. And really the ones you can are the most important in my opinion, which we're going to talk about. Bringing data to a single view is key to me. I know this is a silly spreadsheet looking view, but I'm amazed that, you know, when we're starting to talk to potential clients, we always build ROIs. We want to ask for some basic data. This is not rocket science. I don't know if I've had data given back to me in less than 2 weeks. It's usually in Excel. I spend another week or two doing really fun pivot tables. It gives me a lot of trauma memories from my consulting days. At the end of the day, I'm still not able to get to what I need to be to really be specific on where the financial opportunities are. These things that I'm asking for should be at your fingertips in real time, any time of the day, right? You should be able to look at a pair, physician, or clinic, you know, location, however you want to slice it, and you should be able to look at key measures. Now, these are just example key measures. There's more of them out there, but my point is that you have to be able to make quick, rapid, informed decisions. You know, I use the war analogy at HBMA, you know, whereas, you know, if we're in the middle of a battle and we don't have any eyes or ears above us telling us where the bad, you know, insurgents are, and we were to walk around the wrong corner, what's going to happen? right? This is the eyes and ears. This is saying, don't go left, go right. And how quickly can you do that? And look, we have enough challenges in revenue cycle already. Let's make things easier. Availability of intelligence, which is not the same thing as data. It's not the same thing as dashboards. It's not the same thing as analytics. Intelligence is actually structured data that tells you where you need to be and how to get there. Okay, and that's all areas of revenue cycle. Let's talk about new measures, right? New measures in revenue cycle. Zero touch visit rate, right? How many claims go out the door from your organization and get paid without a human ever having to get involved? It is not the clean claim pass rate. I don't really even care about that anymore. That's everyone says they have 97% clean claim pass rate. Great, but humans are still getting involved. Where? So where in your revenue cycle are you having to get involved, and to what extent are you having to get involved? So how do I move from 50.1% zero touch visit rate up to 60 to 70? How high can I go? I know I'll never get to 100, but how high could I go? As that goes higher, guess what? Labor cost goes down. As that goes higher, net collection rate starts to go up. Okay. So these are all hand in hand. The other big piece is looking at the work effort rate, the effort that has to go into turning denials over, right? AR management, refiling, clearinghouse edits, tasking. Where is the humans getting involved the most? So these are different discussions with organizations now, because we actually have meaningful measures that unfortunately these PM systems can't do. The other big thing for me is really around understanding the collection effectiveness, right? So we talked about zero touch rate, but now I want to look at, are we collecting what we're supposed to be collecting? And if we're not, why? So you look at an example like a Mountain Orthopedic Group there, as collection, only collecting 66.5% of the 100% they expect to get, right? But then look at the exhausted visits there. There's 2.5% of the AR is already exhausted, meaning it's been worked more than 5 times with no payment. Look at the at-risk AR. Look at the work effort that's already going into that. So you've got the highest work effort for one of the lowest results. So if I were this client, I'd be looking at Mountain Orthopedic Group, and I'd start to really understand, why are we having to get involved so much, and where, and what can I now put in place around action plans, people, process reviews. Maybe it's additional technology we need to acquire. Maybe it's technology we already have, we're just not using it right. Okay. These are different conversations with clients than I've ever had before. It's no longer about, oh, my AR days are 30. Great. I don't care. My net collection rate, I don't really know what it is. It should be 97. Right? Those measures worked because that's all we had access to. But now this next generation of analytics with really good structured data capture, the conversation is going to change. It is changing already. So let's talk a bit about front-end financial clearance, because I really, and I was actually on with one of our large ortho groups this morning, literally talking about this theme, is that when you think of accountability, where's the accountability on all the individuals that are trying to do the pre-registration for the surgeries you're about to see, or the new patient visits, right? For the folks that come in through your emergency room, how quickly are you able to clear those patients, whether they get admitted to inpatient or they discharge, right? Who's being paid to do those functions? Are they getting the pre-cert off? Are they actually running eligibility and looking for benefits COB? Are we getting good demographic information, especially a mobile phone number and an email, because that's all how people want to communicate, right? We don't want to talk to humans anymore. Just text me the link to pay my bill, right? What about running patient balance analyses? What are you going to owe me? Did I get a deposit? Did I get a credit card on file? By the way, I like seeing you as a patient, but you already owe me this much from prior visits. Did I collect it? Right. So as I'm kind of going through these things, these are all functions that you're telling individuals to do. But the question is, are they actually doing it? And if they are doing it, is the outcome what you expect? If you have Sally who's doing pre-certs for your organization, but you keep getting first pass analysis for pre-cert authorization, there's a problem. So think about that schedule, and think about where you really need to be to start holding that office accountable. Remember, we're talking about incentive-based revenue cycle. We're not just talking about after the service. A lot of the work is being done before the service or even at the point of service, depending on what type of organization you are. And we know that if that gets right, if you do this right, your zero touch rate naturally goes high. And guess what? Your dependence on labor need in the back office naturally goes low. And if people are highly productive and effective at these functions, your need for labor in these areas becomes lower, right? It's very, very simple, but it's yet so hard to understand because of the limitations we have in RPM. So this is a graphic I like because this kind of talks about where I see the RCM ecosystem, right? If you look at really from the point of scheduling to the point of zero balance, right? What are all the things and who are all the people that are doing roles that you're now paying more money for? And then you've got your integrated task management up top, which is really, that's your chatter, right? So it's not just I'm an insurance eligibility person. I have to ask other people at times in my organization for help. And how do I track that? Okay. So effective intelligence is looking at every aspect of revenue cycle, grabbing the structured data necessary to tell the story of work effort and outcome at an individual and a group level. My margin triangle, if you've seen me at conferences or swing by our booth, you know, I always make jokes with this triangle, but at the end of the day, I've yet to have a conversation in the last year where somebody told me their business objective was not profit margin. But here's the challenge, is that saying you need margin or saying you need to reduce the cost to collect or saying you need to improve your net revenue is just saying it. But what are you willing to do to get it? Right? What are you willing to instill in the organization, whether it's acquiring technology or it's a hard look at your people and process and how they align with technology. So just saying I want margin that's great. What are you actually going to do to get it? And this day and age, I'll tell you right now, the macro things that we're all up against, right? And for those of you that are health systems and hospitals, I empathize even more because you have emergency rooms, you have people getting into the organization that have no intent to pay you ever. You have more challenges out there. But the bottom line is that Medicare is not going to start paying us more, right? Medicaid, not likely. Your commercial managed cares are going to continue to play games with you, okay? We're not moving to 100% value-based anytime soon, right? It may not even happen in my tenure, you know, in healthcare here. So you've got those two big things I'm reducing. What about supply chain and labor costs going up? I think if I had a show of hands, everybody would be like, yep, paying more. Okay, so your supply chain is going up, your labor costs are going up, your overhead's going up, and your reimbursements are going down. Can you really afford to have non-effective people in revenue cycle? No, we can't, because our margin's getting pressured already. And let's not forget about high deductible plans, right? And let's not talk about people will pay for food and shelter before they pay their hospital bills or before they pay their medical group practice bills, right? Or they're going to need a longer payment plan, right? So I'll pay you, but instead of paying you in 6 months, I need 18 because I'm on a fixed income. So think about, I'm not trying to create a lot of trepidation here, but this is reality. This is business reality of healthcare and where we're headed. And that's why I'm so vigilant and hyper-focused on this concept of measuring effectiveness for the people you have. You know, maximize the margin for the things that you're in control. So why are we so limited in this world? This is the diagram, right? So all of our PM systems that we're on, think about the one you're on. I'm not going to name names, but just think about the one you're on, right? So in the bottom left there you see, there's your PM, right? And then you have all these other systems, right? I've got a patient engagement system. I've got a payment portal. I've got a EMR. I've got, you know, a waiting room app, right? I've got all these other things, okay? The problem in today's world is a lot of that structured data is very limited. Therefore, your reporting is limited, okay? And it's really, really hard to get anything in those data systems around effectiveness of employees, certainly when you think about all employees, including the tasking and the chatter. So what we need to continue, and again, the third system I've developed over 20 years, that basically is an upgrade to a PM. Doesn't have to change the PM, but you can upgrade your PM, right? It's no different than upgrading, I guess, iPhones, although technically, I guess you're buying a new iPhone for $1,000. So that was a bad analogy, but upgrade to systems that actually capture that structured data that then can go back into a data warehouse, and it can grab some of the structured data from the PMs and the EMRs and the other systems to produce intelligent algorithms. And that's what we call our EIQ quotients. And so it is absolutely imperative that we all accept this fact that PM systems will never do this for you. They won't. 5 years ago, I would have said maybe. 10 years ago, I said certainly they will. They won't. There's too many other competitive processes going on with the EMR. They're trying to keep the physicians engaged. They're trying to make sure that patients are empowered and engaged in transparency. Who gets left behind are the revenue cycle individuals who are getting you paid for the services that you delivered. They always get left behind, and they're not incentivized. I mean, the show of hands of we're not doing incentivized today speaks to it. We need to flip this around, folks. We've got to incentivize by using meaningful structured data that tells the story of effectiveness for these people. And we need to recognize and reward them. This new generation coming through, and I'm telling you, I hear a lot of early retirements going on. I was a coder for 30 years. I'm an AR rep, used to hammering Blue Cross or Aetna, Cigna. I'm actually going to retire. I'm kind of done with this. COVID gave me a new view on what's important in life. And so now we're having new generational people coming up. And that new generation has a different level of needs when it comes to recognition and reward systems. Okay. Access to intelligence. I already touched on this, so I won't belabor it, but I do want to just make the point, when I started my first workflow automation analytics company back in 2007, big data, business intelligence, dashboards was really starting to become the theme, right? And so for a long time, it's, oh, hey, I got a dashboard that shows me this or that, or I have access to some basic data. I can run pivot tables and those things. But there's a big difference between having access to and intelligence. Right. And that's why I love this concept of effective intelligence, because you can also be intelligent, but not effective with it. Having intelligence is still not good enough. You need to take that insight and you need to do something about it. And you need to be able to measure the outcome of what you did about it and make adjustments if it's not working. When you start thinking about claims, I'm amazed too that 80 to 90% of claims that are going out the door don't need to be looked at, right? Today, they don't need to be looked at today, yet we keep staffing for that. Why? Because we lack the intelligence based on the limiting factors of our PM systems. So we're overstaffed in the business office. I mean, I have so many different examples out there where, we take a big urology group live and she thinks she needs, CFO's like, I need 12 AR reps. And I'm like, you need 3. Now she's got 2, or I was talking with some billing companies that are really just landing a lot of big contracts recently because everybody wants to outsource rev cycle. We don't want to deal with people anymore. So how do you put a technology in place that allows you to scale quickly without hiring? All right. Think about that. Some of you may be in behavioral health, mental health, substance use, those areas too are also really, really accelerating fast as well, right? And so again, how do I double my growth in a year, but not have to hire exponentially? Okay, you do it by having science driving the way you work and ways to measure the effectiveness of your people. I will tell you, morale and accountability is another thing that we've noticed. It's really, really interesting to, once you kind of get past the early stages of, oh my God, you have access to information that tells you how I'm performing. Once we get over that emotion, you really start to see the dissection of the winners and the ones that don't want to be here. And it's pretty fast. And the ones that end up wanting to be here and they're proud of it, it creates camaraderie, it improves morale. People are proud to come to work. People are proud to get outcomes. They're proud. I mean, right? Who wouldn't want to be recognized for the hard work we're doing? That's human nature. And with this new generation coming through, that's the number one focus. Some of the results, these were data's a couple years old, but when we started to really look at moving to this more incentive-based revenue cycle concept, where we started to develop the bolt-on technology to drive insights around effectiveness, things like that, we saw dramatic early results. Big drops in paid hours per month, big improvements to margin, almost completely got rid of overtime, headcounts dropped. And so it was amazing just to see this. And for our business, this was really, really important because our margin was gone practically. And if you're an RCM company, you know what I'm talking about. We bill $1, we collect, 96 cents, but we only get 3 to 5 cents or less. So it's even more pressure for folks that have to do RCM outsourcing services. So let's summarize here. I've touched on a lot of this stuff already in depth, but look, if you can't measure effectiveness, you're not going to be maximizing your margin, and there's too many macro things going on against you that you don't control to live like that anymore, right? Zero touch rate to me is the future. That is really understanding where humans are still getting involved, and then why, and what do I need to do about it? And that's where the intelligence comes in, right? That goes right hand in hand with work effort, right? So when humans have to get involved to get the outcome I expect, how much work did it take? 37 touches to collect $150? That's painful, right? It's distracting to those individuals having to go back and forth on it. Getting work to the right person the first time and resolving that problem the first time you work it, right? Trading your spreadsheets and pivot tables. I actually left Deloitte in 2006 because I vowed at 29 years old I would never do another pivot table. And I was working in the large academic medical centers where I was on bed management deals. We're looking at length of stay. Every month I had to go do a bunch of this stuff. And while I still at times will do a pivot table, 95% of that time is when somebody's sending me their data from their inadequate PM for me to assess. Okay. You don't have time for that. You just don't. When you bill $1 and you expect 97 cents back, get the 97 cents and know whether you're even getting it, right? I didn't touch on zero balance NCR, but that's a measure we love looking at. And because we really can understand what those non-contractuals are and where we could change process and improve things to actually grab that extra penny or two. But I'm amazed at how many organizations, even large ones, can't even answer that question. What's your net collection rate? Well, it should be. Well, I don't like should be. Should be doesn't get me far in life, right? What is it? And then how do I slice it up? Is it, what's the Blue Cross NCR compared to the commercial managed care, compared to the Aetna, compared to the Medicare? When I don't get an authorization, how does it drop? It goes from 97% down to what? 78%. So I can go and say, hey, every time you don't get an auth, guess what, Sally? I'm getting 78%. And we can't run a business at 78% anymore. So again, bringing non-emotional, accurate, objective data to conversations with staff and leaders is always been where we need to be in healthcare rev cycle since I've started my career. But now it's absolutely where we have to be. There's really no more wiggle room, in my opinion. And don't forget about the financial clearance piece, right? I think that's the biggest gap I see in PM systems is there's really no ability to hold financial clearance teams, pre-reg teams accountable for the work that we're paying them to do. We're just assuming they're doing the work correctly. And if they were, we wouldn't have tons of bad debt write-offs. We wouldn't have tons of collection agency fees. We wouldn't have avoidable denial write-offs as well. So that's what I've got, I think. Oh, I forgot my imagining world where this is my soft part of my personality, which doesn't come out much, but could we actually imagine a world where your individuals logged in the morning from anywhere and they did the best job they could and they were the most effective they could be and they were proud of the results? What does that look like today? Right? What does that look like in the future? I can tell you what that looks like. Lean, effective labor, maximum net collection rate, and maximum profit margin. It's the triangle, right? It's maximizing that triangle slide. So that's really the future. We're there now, but we all need to get there fast and keep innovating on this front. Let's not live in the limitations of our current systems. It's not how innovation works, right? I don't use Palm Pilots anymore, right? I dictate into my phone, remind me to shower tomorrow at 7. Pick the boys up from basketball at 3, right? So my life has changed. I don't know why I use the shower one. That's stupid. I do shower every morning. But our lives have changed. So I appreciate the time. It's 10, 15 to 12, 1. So about 40 minutes or so. I think there's definitely some opportunity and time for Q&A. I'm sure the deck will get distributed at some point too. Obviously, if there's questions, hit me up on LinkedIn, shoot an email out. We're happy to engage. And if any of you are at Boston, I'd love to meet you. I'm speaking, I think it's Tuesday afternoon at the show. So I'd love to meet you guys in person. Let's turn to questions. I have to figure out where the questions are. All right, let's see.
Thanks, Matt.
Oh, I got them. Yep. All right, let's see. First of all, why are PM EMR companies not focusing on measure employee effectiveness? It's a good question. I don't blame them. That sounds weird, right? I don't blame them. They don't even really know that they need to be doing it because the market hasn't forced them to know, right? And that's the biggest gap that I see right now is that we as provider groups haven't actually been demanding better ways to measure the effectiveness of the employee across the continuum of revenue cycle. We've accepted what they have to offer, right? So I think that's really big one. And that now, when I make the comment they never will get there, is there's too much fierce competition for the EMR side of the business and the patient engagement side of the business now that to spend the money on the R&D to try to deliver better workflow automation to better ways to capture data, it's cost prohibitive. I think that, let's see. What methods do you currently use to incentivize employees? So we're starting to actually gamify the experience whereby we can tie reward systems in and people can use points to go purchase things and do things that they want to do with the points that they get through outcomes. Historically, we've done everything from cash bonuses to PTO days to potlucks, pizza parties, recognition. I think that a lot of those things are acceptable. I think when people know that the reward ties to the work they're doing as an individual and not just the group, it becomes more important piece. What are the top metrics you use to evaluate RCM employee effectiveness? Work effort and outcome. If I got 2 AR reps working similar types of accounts and one's work effort is much higher than the others and the outcome that person's getting is much worse than the other, we have a problem. So I love looking at that. For the macro stuff in RCM, I love zero touch rate. It's just a nice indicator for me to say, where am I at? I think that's a good one. And I really love the tasking piece, right? Is that, what's the work effort that's going into the ping ponging of tasks back and forth to try to get an outcome. All right, one more. Let's see. What kind of ROI return would I be able to expect from implementing effective intelligence solutions? I think I addressed that really on the triangle slide. As I think, one, you'll stop looking for people you don't need. The ones that you do have, you're actually going to further reduce because you're going to really identify the effective ones that are driving the outcomes compared to the ineffective ones that are just costing you money. I think wherever your net collection rate is today, you're going to see improvement. In some cases, material improvement, which is going to make everybody happy, especially the CFOs. And I think you're going to definitely see your balance sheet or your account receivable stay at benchmark levels. And what's nice about that is it's steady cash flow. We don't have these huge pockets of self-pay AR or insurance AR sitting out there because you got highly effective teams, both financially clearing these patients to improve the zero touch rate and AR staff incentivized to get the job done right the first time. Okay. And there's probably more there, but that's really it. I don't know if that's all the questions. I don't know if there's any more. Aaron, were there more?
No, I'm not seeing any more. Are there any other questions from the group? I want to thank you very much, Matt, and thank our attendees today. And thank you to the Pennsylvania, Virginia, and West Virginia MGMAs for the program. I hope that everyone has a great weekend. Thank you to MedEvolve for their participation today. I certainly appreciate it. And I hope you all have a great trip to Boston next week or in a couple weeks. And thanks again, Matt. We will see you all soon.
Right. Take care, everybody.